Hello, I'm Dr. Jonathan McLaughlin. I'm the LASIK surgeon at Chicago LASIK Center. Welcome to options. So let's get started. LASIK stands for Laser Assisted In Situ Keratomelusis, which basically means through laser reshaping of the cornea. LASIK corrects vision in patients who are myopic or nearsighted up to approximately 10 diopters, and those that are hyperopic or farsighted up to 5 diopters, and those that have astigmatism up to 6 diopters. LASIK involves creating a thin flap that is approximately 20% of the thickness of the cornea. There are two methods that we use to create a flap. One is the femtosecond laser, which places precisely spaced pulses of laser energy into the cornea, separating the layers of the cornea, creating a flap. The other is a microkeratome, a mechanical device that is used to separate the layers of the cornea to create a flap. The femtosecond laser again uses infrared laser pulses to separate corneal tissue, and the microkeratome uses a mechanical device to create a flap. So the laser flap creator, or the femtosecond laser, was designed to help eliminate flap-related complications that were seen with the older style microkeratomes. We use the Alcon Wavelight EX500 excimer laser to reshape the cornea. It uses a cool ultraviolet laser beam to precisely sculpt the cornea to create changes in the curvature that corrects vision. So each pulse of the laser removes approximately 0.25 microns of tissue, and the average treatment time is between 5 and 15 seconds. Due to numbing drops, patients cannot feel and they cannot see, due to the ultraviolet spectrum, the laser light. There is a flashing green fixation light that patients are asked to look at during the treatment. The picture at the bottom of the screen shows a human hair, which is approximately 50 microns in diameter, and the etchings that are in that hair were made by the excimer laser. So you can see that it is a very precise and accurate means of removing tissue. The method that we use to plan this tissue removal is called wavefront optimized custom LASIK. It utilizes wavefront technology that was derived from the field of astrophysics. We use a scanner called a Vario scanner to scan and map the corneal surface as well as iris, and we link this scan data to the laser for a more precise, customized laser vision correction. So the picture of the lower left shows the Vario scanner, and the picture on the lower right shows a corneal map that was produced using the data from the Vario scanner. There are many data points. You can see that it is very accurate at detecting the curvature of the cornea, and this data is used in planning the treatment of each eye in a unique manner. So wavefront optimized custom LASIK is a precise and safe method of laser vision correction. Again, it's customized for each eye, and due to the shape of the cornea that this device helps us create, there is a lower incidence of nighttime glare and halos, and a general overall improvement in the quality of vision. Approximately 97% of patients see 20/20 or better without glasses. What are some of the limitations of LASIK? LASIK does not correct poor vision due to lazy eye or amblyopia, corneal scarring due to past infections from contact lens use or disease processes, poor vision due to glaucoma, or poor vision due to a cloudy human lens, which is a cataract. Macular degeneration involves thinning and degeneration of the macula, the retinal tissue in the back of the eye, and changing the curvature of the cornea will not correct vision that is poor due to that problem. Presbyopia is a problem that laser vision correction can improve in a limited fashion. We use the laser to help treat presbyopia, which literally means aging eyes in Latin. The age-related loss of the ability to see near through a full distance correction. It's due to progressive growth of the human lens and hardening of the human lens with age. It starts generally in the 40s and can progress with age. So the strategy that we use to treat presbyopia, it's called monovision, where we measure the dominant eye, the stronger eye, and we set that for distance. And the weaker or non-dominant eye, we set that for near. So we use this to reduce the dependency on reading glasses for those over 40 years of age. It's a compromise. It's not something for everyone. It's something that we do a trial of to see if someone would benefit from this strategy. And there are certain occupational limitations in terms of choosing this strategy. And that's something that would be discussed with you at the consultation or the examination. Side effects of LASIK. One of the most common ones is dry eye. We recommend the use of artificial tears on day one. And dryness can cause fluctuation of vision. It can exacerbate halos and starbursts at night. And these types of side effects typically resolve with time and the use of artificial tears and healing. There is also the chance of under or overcorrection. That's just due to the variability in healing when your cornea is exposed to laser energy. How you respond to the laser energy is unique compared to somebody else, your own age and prescription. So this occurs in approximately 3% of patients, and the strategy for dealing with this side effect is to have a retreatment sometime within 3 months of the procedure. And the timing of that is dependent upon the stability of the prescription that we're treating. Sometimes early on, it can look like there is an over or under correction, but with time and healing, that actually goes away and does not require additional surgery. In those cases where it does not go away, that's where a retreatment strategy would be utilized. So what are the benefits of LASIK? It's a procedure that has excellent reproducibility, It's quick, painless, and generally safe procedure with a very rapid visual recovery. Most patients are able to resume their normal activities, including driving, often the very next day. It has good long-term stability, and it's very easy to fine-tune with retreatments if necessary. And compared to contact lens use, the long-term risk of LASIK side effects or vision loss is much lower than contact lens wear over a lifetime. I personally have had LASIK myself. It's been over 20 years ago. I have never needed a retreatment despite having a huge amount of astigmatism and nearsightedness. I do have presbyopia now, and I do utilize reading glasses to read fine print. So who's a potential candidate? Well, you need to be at least 18 years of age. You need to have a stable prescription for approximately 1 year. And it's important that you're not currently pregnant or nursing. Hormonal shifts and fluid shifts with those activities can cause changes in vision. And it's the safest route would be to deliver or complete your course of nursing before embarking on laser vision correction. And you need to have generally healthy eyes without signs of cataract or other significant eye disease. So another common option for those patients that are not candidates for LASIK or choose not to have LASIK is surface laser correction. It's laser vision correction without the flap. It's where the excimer laser treatment is applied directly to the surface of the cornea after I remove the thin epithelial layer during the procedure. This epithelial layer naturally grows back in 3 to 5 days, and the results are equal to LASIK. It does have a slower recovery, and there is slightly more discomfort with surface treatment for the first few days compared to LASIK. It's generally safe for patients with thin or irregular corneas. Another option for those over 45 and who may or may not be presbyopic is refractive lens exchange. This alternative to LASIK involves, for those patients who are nearsighted, farsighted, or have astigmatism, it involves removing the human lens and placing an artificial lens similar to a cataract surgery. So the implant that would be placed would be a bifocal implant, so you would have the distance correction as well as the near vision that you desire. Another option for those under 45 and that have large amounts of nearsightedness is an intraocular contact lens, or ICL. This procedure does not involve removal of the human lens. It involves placing a thin contact lens behind the iris, but in front of the human lens. And it's an excellent alternative to LASIK for higher corrections in patients with thin corneas. It also has a rapid visual recovery. Why choose Chicago LASIK Center? We spend an extensive amount of time with each potential candidate, helping them understand their options, if any, and which procedures may be appropriate for their particular situation. We include post-op care in all of our treatment packages, and we offer the very best in technology at a competitive price. We offer a variety of services and procedures to help correct vision. We don't just do one procedure. We also offer a lifetime commitment program that is available with certain restrictions. Common questions. What if I've had prior LASIK surgery or prior surface treatment? Am I a candidate for further laser vision correction? Generally, someone that has had prior LASIK or prior surface correction may be a candidate for further correction, depending upon how much treatment was done in the beginning, how much tissue is available, and what is the prescription that we intend to treat. Another one would be, what if I'm diabetic? Well, a well-controlled diabetic is not a problem with LASIK or surface treatment. It's those patients that may not be well-controlled that can cause your vision to be nearsighted due to the elevated blood sugar. And so we would be treating a false prescription. And so we want your diabetes to be well-controlled before ensuring that you're a candidate for LASIK or surface correction. And if you've already been told that you have cataracts, well, cataracts can progress. When and if they do, that is something that needs to be monitored. And the better option would be to wait until after you've had cataract surgery, because that corrects distance and near vision, or can correct this distance and near vision and astigmatism with the proper implant. And these are things that LASIK generally cannot do. So it's better for someone to have cataract surgery rather than LASIK surgery or surface correction. Well, I want to thank you for attending our web class today. I'd like you to be aware that we do offer same-day LASIK surgery for certain prescriptions, and that you can schedule your complimentary LASIK consultation and exam online at our website, www.chicagolasiccenter.com. Or if you'd like to talk to staff members, we have staff members available in the evening hours and on weekend hours. Our number is 312-955-0025. Have a great day, and thank you for attending our web class.